Hello and good day, everyone. Today we are presenting our research entitled Nigella sativa-derived nanobioactive antimicrobial as a next-generation intracanal medicament for resistant endodontic pathogens. This research explores how Nigella sativa may serve as a bio-based alternative in endodontic treatment, particularly in managing bacterial infection inside the root canal. When a tooth experiences deep caries or trauma, the pulp tissue can die and become infected. In such situations, root canal treatment is performed to remove the infection and preserve the tooth. However, even after adequate treatment, there remains a risk of reinfection because certain bacteria are able to resist intracanal medicaments that are commonly used. A key cause of endodontic treatment failure is persistent bacterial infection within the canal. Among these, Enterococcus faecalis is most commonly detected. It is a gram-positive facultative anaerobe that survives in harsh conditions and forms biofilm, making it difficult to eliminate and a major challenge to long-term treatment success. Currently, calcium hydroxide, or CaOH, is widely used as an intracanal medicament. Nevertheless, calcium hydroxide has several limitations. It can impair periapical healing, occasionally cause osteolysis, and more importantly, it is ineffective in eradicating E. faecalis. Research also indicates that E. faecalis can form biofilm on calcium hydroxide surfaces, further protecting the bacteria. Hence, there is a need for a natural and more effective alternative, such as Nigella sativa. Nigella sativa is a traditional medicinal plant containing several active compounds, including thymoquinone. These components contribute to its antibacterial, antifungal, and anti-inflammatory properties. Among them, thymoquinone plays a central role by inhibiting biofilm formation, thus preventing bacterial adhesion and survival. Previous studies demonstrated that Nigella sativa extracts are effective against Streptococcus mutans and asanguis, suggesting it could be a promising natural alternative intracanal medicament. The objective of this study was to evaluate the antibacterial activity of Nigella sativa, Aqueous extract against Enterococcus faecalis, and to compare its effectiveness with calcium hydroxide as an intracanal medicament in endodontic use. 3 laboratory tests were performed. First, the minimum inhibitory concentration, or MIC, to identify the lowest concentration that inhibits bacterial growth. Second, the minimum bactericidal concentration, or MBC, to determine the concentration that kills the bacteria completely. And third, the adherence test, designed to evaluate how well the extract prevents bacterial attachment to glass surfaces, simulating biofilm inhibition. The results showed that Nigella sativa extract displayed strong antibacterial activity against E. faecalis. The MIC value was significantly lower compared to calcium hydroxide, indicating superior inhibition of bacterial growth. Most notably, the bactericidal concentration of Nigella sativa was only 3.12 micrograms per milliliter, whereas calcium hydroxide required 50 micrograms per milliliter to achieve a similar effect. This demonstrates that Nigella sativa can eliminate E. faecalis at a much lower dosage, showing higher potency and efficiency. In the adherence test, Nigella sativa extract significantly reduced bacterial attachment to glass surfaces when compared to calcium hydroxide. This indicates excellent anti-biofilm activity, a crucial feature because E. faecalis biofilm is one of the major causes of post-treatment failure. Statistical analysis confirmed the difference was significant with p less than 0.05, validating the reliability of these results. Overall, our findings highlight that Nigella sativa possesses strong antibacterial and antibiofilm properties against E. faecalis. The active compound thymoquinone likely disrupts the bacterial membrane and prevents biofilm development. Compared with calcium hydroxide, Nigella sativa is effective at lower concentrations and potentially more biocompatible since it is plant-derived. Nevertheless, because this research was conducted in vitro, further in vivo and clinical studies are required to verify its safety, stability, and the implications of incorporating Nigella sativa and thymoquinone into endodontic practice are profound. 1. Enhanced disinfection protocols. Thymoquinone may improve disinfection in cases involving E. faecalis. Its effectiveness at lower concentrations could reduce toxicity to periapical tissues compared to traditional agents like calcium hydroxide. 2. Biocompatibility. Nigella sativa has a long history in traditional medicine with a strong safety profile. Its natural origin may increase patient acceptance and reduce adverse reactions linked to synthetic antibacterial agents. 3. Combination therapy. Thymoquinone can be combined with existing treatments to enhance efficacy, for example, incorporating it into calcium hydroxide pastes to boost antibacterial activity while maintaining alkalinity and tissue compatibility. 4. Novel formulations. New endodontic medicaments containing thymoquinone could target resistant bacteria while promoting healing and tissue regeneration. 5. Research and development. Further studies are needed to determine optimal concentrations, delivery methods, e.g., irrigant or intracanal medicament, and long-term outcomes to establish clinical protocols. In conclusion, the antibacterial potential of Nigella sativa, particularly its active compound thymoquinone, offers a promising path for innovation in endodontics. Its efficacy against E. faecalis, combined with excellent biocompatibility and natural origin, makes it a valuable adjunct or alternative to conventional disinfectants. Embracing such bio-based approaches may enhance treatment outcomes and address challenges posed by resistant bacterial strains in dental practice.